Well, can you believe what happens in the area of nutritional science under the name of good research? So recently, this credible article in the American Journal of Cardiology in 2010 was published, whose title you've heard about, I'm sure. Can a statin neutralize the cardiovascular risk of an unhealthy diet? Well, that's an interesting question, right? And then you look at the paper and you find out that the work that was done was to do a meta-analysis of statin-related studies to see if, in fact, the cholesterol-lowering effect of a statin would be able to reduce the risk of increased cholesterol and blood lipids that's associated with the consumption of daily fat, such as a 7-ounce quarter pounder with cheese and a small milkshake. Some people have called this the MAC statin study. And I find it very, very interesting as you go on that they say in this study that people eat unhealthy, so what are we going to do to neutralize unhealthy dietary habits? Possibly fast food outlets then should, who offer condiments already, should offer statins as a side of kind of product for their meals so they can neutralize the unhealthy choices that people are making. This is published in the American Journal of Cardiology. Do you find this at all as paradoxical and quizzical and contradictory as I? It's very, very interesting that we would even have this scholastic discussion among cardiology specialists rather than to really define how we're going to encourage people to eat things that are supportive of long-term good health and well-being, and how we're going to promote within our fast food and our food supply system the production of foods that actually lead to compression of morbidity and expression of full vitality and living out to the limits of one's healthy life expectancy, lifespan. These are really, to me, very amazing times. There are times where we have the best of all worlds and times where we have the most confusing of all worlds happening simultaneously. So what would be the answer? What would be the response to this kind of article? Other than maybe to just shake our heads with complete querulous confusion. I think the response is that we recognize from controlled studies that have been done in humans that by small modifications of dietary habits, that cholesterol can be lowered, HDL can be increased, the lipogenic, atherogenic cholesterol, dense LDL particles can be reduced, triglycerides can be reduced, and insulin sensitivity can be improved by fairly modest dietary changes, going to eating lower on the food chain, eating fresh, eating fruits and vegetables with color, texture, eating minimally processed. It doesn't require moving to a foreign planet or completely changing the way that we ascribe our daily lifestyle habits, but just modest changes, rather than the consumption of a condiment that we call a statin to neutralize unhealthy dietary changes or dietary choices. Very, very interesting time. So keep tuned. A lot more yet to be learned about this.